When you're missing a tooth, you've got a couple of options to replace it. If you're looking for something fixed that stays in your mouth that you don't have to take in and out, there's basically two options. Hi, I'm Dr. Brett Langston. I'm a prosthodontist, and I'm the owner of Dental Implant and Aesthetic Specialists here in Georgia. And I'm here to help you watch your mouth. So the first option to replace a missing tooth is one that we've done for years and years. It's essentially a dental bridge. So what happens with a dental bridge is you remove some tooth structure, or you take the crown off of the tooth next to the missing tooth on both sides. You do an impression, make it temporary. A couple weeks later, you come back and the permanent bridge gets cemented in place. Dental bridges are great. It's been tried and true. Some of the longest lasting restorations we do in the mouth are a bridge from canine to canine, replacing some of these bottom front teeth. So it's a great solution. The advantage of dental bridges is that we can modify the appearance and the shape of the teeth next to the missing tooth. So if you're missing multiple teeth, or you have unesthetic teeth next to the missing spot, we can control and essentially camouflage over that and give the appearance that all those teeth are there and are uniform. Some of the disadvantages to a dental bridge are that we do have to reduce tooth structure on the adjacent teeth. And so if you have two naturally healthy teeth without any damage, and you like the way they look, you like their function, and you're wanting to replace that missing tooth, a dental bridge probably isn't your best option, because you do have to modify the appearance and the tooth structure of those teeth. So in that situation, another option would be a dental implant. Dental implants are a fantastic solution in that regard, because essentially we go right in that space, put the implant, it's made out of commercially pure titanium, right in the bone, let everything heal, and then we build a tooth on top of it. Some people ask, what's the difference in price, timing, what are the advantages and disadvantages of a bridge versus an implant? And that's a great question, and I don't want to give a cop-out answer and say every situation is different, but every situation is different. In the situation where you've got adequate bone, adequate healthy tissue, and the adjacent teeth are in a good situation, I would say an implant's probably the best solution. When patients ask, am I an implant candidate? There's a whole lot of questions that we go through to make sure that you have the proper bone and your mouth is healthy to support an implant. So for an implant, which is essentially a titanium, a metal screw that we put in the bone, we have to have a couple of factors. Number one, we have to have the space between the teeth on either side. So if the teeth are super close, we can't fit an implant in the bone. So once we know we have the space between the teeth, we also have to look at the bone that we're putting the implant in. If you've got a really collapsed arch, which means if you've lost the tooth a long time ago and the body kind of remolded and shrunk down that bone, there's not enough bone to support the tooth. So we have to have bone not only from the front side to the roof of your mouth, but also on either side to support that implant, because an implant has to be all the way in bone, otherwise it'll fail. So if we've got the good bone, we've got the space between the teeth, the last factor is we need to make sure that your mouth is healthy enough to support that new bone growing onto the implant, because it's a pretty cool process. The process is called osseointegration, and basically that's a big fancy word to mean that your bone cells will grow onto the surface of the implant. And so implant companies today are coming out with more and more techniques, more and more materials and chemicals to support that bone growth, but it's a pretty neat process, and it's a process that's absolutely necessary for the success of an implant. So if we've got good bone, got good space, and we've got a healthy mouth is one that is going to allow the implant to succeed. Anybody that's dealing with untreated diabetes, really heavy smokers, previous radiation therapy, if you're on a lot of the bone growing medicines now, the Fosamax, the Boniva, these are all things that we need to really sit down and look at. And a lot of times we need to consult with your physician so everybody's on the same page with how your mouth is going to respond. Because the last thing I want to do is put you through this surgical process and have the implant fail. Because when an implant fails, unfortunately, you're left with some bone loss. And we have solutions to counteract that. We can always bone graft the area and come back. So it's not the end of the world, but it just adds on to the treatment time and the cost and the involvement. By the way, that's the sign that you're in the right office when they take the time to go through your medical history, to go down and check off all these boxes to make sure that you're not just jumping into an implant because they want to get it done, you want to get it done, and everybody just assumes it's going to be okay. Implants are a very successful treatment option. In fact, it's probably single tooth implant is one of the most successful things we do. But the reason it's so successful is because over time, the last 20, 30 years, we've really figured out what reasons are causing these implants to fail. And if we can eliminate patients with those conditions, implants are a very successful treatment option. So if you're going somewhere and you walk in and they're like, we'll do an implant right now, that's probably not the place you want to be, because there's a good chance that they haven't done the research. They don't know the things they need to know, honestly, to make sure you have a successful implant. The cost of an implant versus the cost of a bridge is definitely something you want to take into consideration, but you shouldn't let it be the determining factor. In our office, typically speaking, a bridge and a dental implant with the crown on top are roughly in the same neighborhood. Sometimes if you're doing multiple implants, that's more expensive, or if you've got multiple teeth on a bridge, that can be more expensive. But we've structured it that way so we don't let finances kind of drive the train on your treatment plan. The most important thing for us is to provide you with the solution that is the best for your mouth, and the finances, they'll be roughly about the same. Why is this so expensive? Unfortunately, like a lot of things, if you've gotten grocery shopping lately, you've gotten gas in your car, everything seems to be getting more and more expensive. And unfortunately, dentistry is in that same vein as everything, all the different parts and pieces that accumulate the cost for us. Unfortunately, dentistry is expensive. And we understand that, and I respect that. So when you do a dental bridge, there's two appointments, essentially. The first appointment where we get you numb, we remove any tooth structure that we need to do, we make our impression. That impression is sent off to a lab, and we use really nice labs that take their time and use high quality materials. They do a really good job with precision matching, not only in the fit and the contour, but also in aesthetics and function. On top of that cost, there's the cost of the materials. A lot of times the materials and the labor, it adds into the cost. And then the next appointment when you come back, that takes time as well, and materials as well, because we have to cement that bridge into your mouth permanently to attach it. I always tell patients it's not cheap. It does cost money, but look at it as more of an investment in your mouth and your health than a bottom line expense. So another thing to consider when looking at the cost and the investment in a bridge or dental work in general is this is not something that you throw away. This is not something that you splurge on a vacation and you have memories. This is something that you use every day. And not only do you function with it, chew with it, it's an aesthetic part of you. It's part of your smile. It's part of your overall health. And so that really kind of, if you can frame your mind about this is an investment in my appearance, this is an investment in my function, this is an investment in protecting from further breakdown, from further pain and discomfort. So if you look at it from that frame, it really does make it a worthwhile investment for a lifetime. So a question to ask yourself is, how often do I use my teeth? And when you think about it that way, it's pretty impactful. Implants, why are they so expensive? Great question. A lot of time and money has been put into research development into these materials. When you put an implant in, our goal is to have that stay in your mouth, in your body for the rest of your life. And so if you're going down that road and you're gonna put something in your body, you wanna make sure that it's a quality material. You wanna make sure that it's gonna last a long time. You wanna make sure that it's not gonna have negative consequences on adjacent body parts. And to make sure we have that, we only use highly researched, highly respected companies that have spent a lot of time and money to make sure that the product that we use is going to last a long time. You don't want to go and get a hip replacement and just have them throw a plastic piece in there. It's the same kind of concept. And those parts and pieces from the implant companies are expensive. And so that kind of underlying with the lab costs and fees and all the training and materials we have to have on our end kind of bring the cost up for a dental implant. But the value from that investment, in my opinion, far outweighs the cost initially, because you're putting that implant and you're getting a tooth that you're going to use for the rest of your life. You're going to chew on it. You're going to function with it. If it's in the front, you're going to smile with it. You're going to see it every day. You're going to see it in pictures. You're going to see it in mirrors. And so while it may seem like an expensive investment at the beginning, it's absolutely worthwhile long-term investment. When you're faced with the dilemma of do I get a bridge or an implant, that's going to be best determined by your doctor and you sitting down and coming up with an ideal plan for you. We take into account, where's the missing tooth? How healthy are the adjacent teeth? How healthy is the rest of the mouth? What kind of materials do we want to use? How much function or duress is this missing tooth going to be under when we replace it? These are all factors that go into our decision tree, as well as your health and the health of your mouth. One of the other key differences between a dental bridge and an implant to replace a missing tooth is the amount of time it takes to go from when the tooth is extracted or when you take the tooth out to when you get the final product in your mouth. Now, I love implants. We do a lot of implants here, and I think they're a great solution. The downside to implants is that it takes a long time to get the actual tooth in your mouth. That's one of the big advantages of a dental bridge is The day that we prepare those teeth to make that bridge, we make you a temporary bridge that replaces that missing tooth. And then to get the permanent bridge in about 3 weeks. So from missing the tooth to replacing the tooth is about a 3-week span. Now there are differences in that. If we have to extract a tooth and we're waiting on healing, sometimes that can take a little bit longer. But generally speaking, getting that permanent final tooth that you can function with and chew on is much shorter when you do a dental bridge. With an implant, a lot of times we wait for the implant to heal, and that can take about 3 to 4 months for that process for the body to actually grow that bone cells. And once the implant is healed and the surgeon and I kind of agree that we're ready to restore, then we start the process of building the tooth on top, which can take another 3 to 4 weeks because there's a lot of technical work with the lab and myself making sure we build and design the right shaped tooth that goes on there. So that's kind of the primary difference. A dental bridge, in theory, you can get it about a month after you lose the tooth. An implant's going to take you about 4 to 5 months. So, if time is of the essence and you need something right away, sometimes we factor that into our decision tree. But that's the primary difference in timing. So come see us. If you're missing a tooth and you want to know what your options are, we'd love to help you out. I'm Dr. Brett Langston. I'm a prosthodontist, owner of Dental Implant and Aesthetic Specialists here in Brookhaven, Georgia, and I'm here to help you watch your mouth. Yeah, thanks, man. No worries, man. I appreciate you.
All right. Y'all have a good weekend.
What was your name? I'm calling UPS.